Good evening. My name is Raina Bowen, and I just wanted to say thank you all for being here today. Today, I'm going to review a business plan or a business proposal for a outpatient wound care clinic. Currently, chronic wounds impact an estimated 8.2 million patients and cost a staggering $28.1 to $31.7 billion annually. An estimated $18.7 billion of that annual cost stems solely from individuals with diabetic foot wounds. Chronic non-healing wounds are often a result of a compromised healing process related to an individual's underlying illness. Given the growing prevalence of diabetes and obesity, these numbers are only anticipated to grow and increase within the next several years. The management of wounds in an inpatient setting can be taxing as it consumes our resources and our healthcare dollars. Utilizing an outpatient clinic would allow for a more preventative and proactive approach to wound care and would alleviate a good portion of the burden that it's placing on our inpatient hospital. A key benefit to an outpatient wound care clinic would be providing continuity of care for patients and their families. This business proposal will emphasize the need for an outpatient wound clinic. Today I'll discuss the rationale behind its necessary establishment, discuss an implementation timeline for the first year of operation. I'll highlight cost and benefit, and I will assess methods of evaluation that highlight quality and financial outcomes, as well as review marketing strategies. So our rationale: the need for this wound care clinic reflects the increasing incidence and prevalence of not only chronic wounds, but also the tremendous cost to the healthcare system that these patients represent. A wound care clinic would address the need to provide high-quality wound care to decrease incident rates and healthcare costs. There are several strengths to the proposed project. First, Azusa Regional Medical Center is already an established facility that will have reputation and credibility for the outpatient wound clinic to thrive. Establishing this clinic would allow for more efficient use of hospital beds and resources within the current inpatient facility. There's currently already a specialized wound care nurse already established within the inpatient setting that will assist in the transition to the outpatient market. Increased access to specialized services will allow for more timely and effective treatment. The clinic's main focus will emphasize swift and preventative care by utilizing an interdisciplinary team to combat the complexities of chronic wounds while also driving down costs. The major weakness would be the initial increase in capital expenditures, i.e. hiring more staff and startup costs. This program addresses the increasing high-risk patient population diagnosed with type 2 diabetes. These patients require a high level of care due to the complex nature of their disease. By establishing an outpatient wound care clinic with specialty wound care nurses, it would provide patients with quick wound care services, save hospital resources, decrease organizational costs, decrease inpatient length of stay, and decrease rehospitalization rates. Patient education resources will also be of high importance to ensure that the patient is fully aware of the complications related to their illness prior to discharge. So the implementation plan: although the first year of operation is anticipated to be roughly accompanied by setbacks, loss, change, and the unknown, continuous quality improvement is pivotal. It is critical that the failures and shortcomings are met with understanding, determination, and resolution. So for the first 6 months prior to grand opening, the predominant focus during this time is to get the clinic set up for how it's going to be intended to run during operation. Standardized methods of care will be established as preferred desired outcomes of treatment are identified and procedures for treatment are established. A budget for the clinic will have been created, presented, and approved. Therefore, purchasing of initial necessary supplies will occur during this time. Stakeholders, consumers, and medical staff have been identified by this time. However, as the grand opening approaches, it would be necessary to reiterate the importance of the wound care clinic, share the clinic's goals, values, vision, present the accepted policies and procedures, and review intended outcomes. Simultaneously, all licensing requirements, health codes, and safety requirements and regulations, and any other pending approvals for the building would be approved during this time. From July to mid-July, marketing should continue to take place as brochures are readily available and stakeholders, consumers, and medical professionals spread the word. Physicians are encouraged to promote the new clinic to their patients and begin referring patients to the new clinic. Within the first week and a half of July, staff will attend a mandatory new employee orientation to review the policies, procedures, treatment goals, outcomes, and various healthcare strategies to appropriately meet the needs of the outpatient clinic population. Staff will be encouraged to provide any and all feedback at the conclusion of their training. The remaining time prior to accepting patients will allow time for staff to become acclimated to the clinic and for final review of the clinic to ensure it's equipped for opening. Mid-July to September, the grand opening will occur in the middle of July and operate Tuesday through Saturday, 8 a.m. to 4:30 p.m. These 3 months will be a significant transition period for the clinic as everyone settles into their roles within the clinic and policies and procedures are utilized. At this time, quality improvement efforts remain critical, where there will be an ironing out of any and all processes. Staff meetings will be held each month within this period to address concerns, discuss potential changes, provide feedback, and to review the clinic goals, values, and visions to determine if the clinic is adhering to and anticipated to meet its projected goals and outcomes. October to January. These following months will emphasize increasing patient census and enhancing educational training programs for both patient and staff. The goal is to maintain established consumer base while also looking to gradually increase the number of patients over the remaining course of the year. Data analysis will occur at this time to determine anticipated clinic quality and financial outcome. Additionally, meeting with key stakeholders will take place to review the projected course of the clinic and note any deficiencies that require remediation or improvement. February to June, these remaining months will capitalize on the return of patients. At this time, the clinic will be operating at a steady pace. Within the last month, a cost analysis will be completed and return of investment will be evaluated. Further investments will be made at this time to further improve patient outcomes, enhance the clinic, or provide more specialized treatment like hyperbaric oxygen therapy to further generate a greater revenue. So cost and benefit, there are several key cost considerations for the proposed outpatient wound care clinic. There is a need to hire additional specialized staff to not only adequately staff the clinic, but also address the complex needs of the particular population. For this reason, the proposed budget includes hiring a full-time nurse practitioner, a part-time registered nurse who's certified in wound care, a full-time medical assistant who may also function as a secretary. Specialized training and or certification may also be provided and has been included in the budget proposal, along with diagnostic equipment and key wound care considerations, or wound care products. Some of these products include examination tables, exam room equipment, computers, glucometers and their equipment, therapeutic support surfaces, enteral nutrition to optimize wound healing, compression therapy, bariatric products for accommodation, possible hair lifts, Dopplers, wound vacs, and standard dressings. It's also critical to take into account the standard reoccurring expenses of the organization: salaries, wages of staff, taxes, employee benefits, insurance, professional fees, office medical supplies, and standard maintenance of the facility. The salaries and wages of the staff have been determined by their level of experience, certification, and education. Expected revenue sources, in addition to the Azusa Regional Medical Center funding, will include Medicare grant funding from the Wound Healing Foundation and self-pay or out-of-pocket costs, in addition to educational seminars. Each revenue source has its own consideration in regards to coverages, reimbursement rates, and limitations. For example, some insurances set limits to outpatient care treatments and particular products, which could potentially contribute to patients incurring high out-of-pocket costs. Return on investment for the proposed program would first and foremost address the growing demand for type 2 diabetes management. The wound care clinic would provide a multidisciplinary approach to treatment and address any underlying health conditions. It would enable a more timely, effective response to treatment as well. The program would also provide specialized care staff trained specifically to care for the high-risk patient condition. By providing a higher quality of care through the outpatient wound clinic, it would assist in decreasing patient length of stay and hospital readmissions. There would also be an increase in hospital branding and marketing that can contribute to an increase in the patient population. So our projected total revenue for the year would be $10,264,326, and our total projected expenses for the year would be $3,166,843.58. So we are anticipated to generate quite a bit of revenue. So our evaluation plan are quality outcome measures. Quality outcome measures that will be used to demonstrate the success of this program will be patient experience surveys and rate of readmissions. The goals of these quality outcome measures are not only to enhance patient-centered care, but also to standardize care policies and procedures so as to optimize treatment, decrease treatment duration, and decrease the rate of readmissions. Patient surveys will be completed at the end of each visit and distributed at quarterly intervals every 3 months. It is critical that programs seek to maintain a high quality of care that facilitates strong, trusting physician-nurse-patient relationships. Additionally, patients are twice as likely to report feelings of dissatisfaction with a particular facility or a physician than a positive one. Readmission rates will be evaluated at 3, 6, and 12-month mark of operation. Evaluating readmission rates would not only highlight quality of care, but also is also a key indicator of profitability. Standard benchmark for centers of Medicare and Medicaid services is 30-day readmission rates, with at the 80th percentile or lower being considered optimal. The goal would be to decrease readmission rates by 10% at months 3, 6, and 12. Financial outcome measures that will be utilized to demonstrate the financial success of the program will be referral rates, patient staff turnover, and increased education training and or wound care certification. The goal of these financial outcome measures would be essentially to determine if the clinic is generating sustainable revenue. Upon a patient's initial visit, the patient will be asked to fill out general information and include how they heard about the clinic. The increased rate of referrals would correlate to an increase in patient census and indicate a greater demand for services. Incentive programs may be utilized after evaluating the clinic's return on investment after 6 months. Personal referrals would then receive a $25 Visa gift card. Increased patient turnover could indicate that care is being delivered more efficiently and healing is occurring more quickly. Patients' length of stay is shorter and less resources are being utilized. Therefore, more money is being generated from seeing more patients. This data can be collected in quarterly intervals by analyzing the number of patients seen within a given period. In contrast, high staff turnover rates would indicate poor staff satisfaction and would lead to a greater cost to hire and retain a new staff. So, taking that in consideration, efforts will be made to retain current staff. Reward and incentive programs will be considered after the first year of operation. Satisfaction surveys can be distributed periodically throughout the first year of operation during their quarterly assessments. Staff meetings will also be held once a month to address current clinic issues, policies, procedures, and to brainstorm ideas that can lead to greater revenue in the future. Finally, an increase in educational training and or wound care certification would generate greater revenue and enable specialized clinicians, caregivers to optimize care within their workplace. The clinic will host its first large-scale educational training during the second month of operation and continue every 2 months thereafter with the intent to have a full class of 20 persons by month 9. If demand for certification and or training remains high, classes will begin on the second Thursday of every month. Now getting to marketing, several consumers have been identified for the proposed outpatient wound care clinic. One major population will be those individuals suffering from chronic non-healing wounds resulting from diabetes, hypertension, obesity, immobility, old age, poor nutrition, incontinence, etc. Many of the individuals that will be seen have comorbidities that contribute to the complexities of delayed healing. Individuals with trauma wounds, burns, surgical wounds, compromised skin grafts, flaps, radiation tissue damage, or gangrene will also benefit from the proposed program. These individuals have been chosen as the target audience for the marketing plan because the incident rate among these particular individuals are anticipated to significantly increase, especially those who are obese and diagnosed with type 2 diabetes. Additionally, potential stakeholders to the program will consist of doctors, nurse practitioners, specialty nurses, home health agencies, SNFs, and wound care supply manufacturers. These stakeholders were selected because these individuals and agencies are experiencing chronic wound care's prevalence at its core and are aware of the persistent problems that are associated with these complex cases. Initially, the clinic will rely predominantly on word-of-mouth marketing with a goal to move to a more strategic marketing plan as the clinic begins to generate more revenue. Marketing will focus highly on customer service, a positive experience, and creating trust and referral recommendations. Minimal to no cost is anticipated for marketing within the first 6 months of operation. Brochures will be created, updated, printed, and provided by the medical assistant, and office supply costs have already been accounted for. At month 6, depending on the generated revenue, marketing strategies could expand to social media outlets, websites, posters, newspaper ads, and billboards. With that being said, here is our brochure. It can be mailed to patients as well as handed out. It is in a trifold. It lists our mission, vision, and values. And then if you flip it over to the back side, it provides patient education as to why wound care is important, why to choose us as an outpatient clinic, and gives feedback from other patients. Thank you so much for your time. I appreciate your consideration, and thank you.